to order. Today is Wednesday, April 15th. At this time, I would like for each audience member to stand, state your name clearly, and indicate who you represent. Start with you, Daniel.
Scott Daniel, Board of Pharmacy.
Rebecca Tyndall, Board of Pharmacy.
Logan Gray, the Southern Group.
Auburn student.
Jim Easter Citizens Hospital in Orlando.
Roland Osmond, Infirmary Health.
Nick Carter, Huntsville Hospital.
Brad Livingston, Walmart.
Heather Hughes, Publix.
Nikki Hunter, Cover Fusion.
Taylor Backer, Sanford student.
Evelyn Senwo, LMC Med Consult.
Charlie Green, Walgreens.
Melissa Farrow, Walgreens.
Anderson, Board Pharmacy.
All right. At this, we appreciate everybody, giving us your name and who you represent. If there's anyone on the WebEx that does not have their full name on the screen, please email that to John Lena at jlena@albop.com so that we can get you recorded for the record. So before we get started, I'm gonna ask, Mr. Brooklier to provide us or lead us in a prayer, and then we'll do our pledge.
Thank you, Dr. Cobb. Let's bow our heads, please. Lord, thank you for this opportunity to serve you, to serve this profession, and to serve the people of Alabama. Be with us today as we do your work. Give us the knowledge to make good decisions and the strength to execute. We ask these things in the name of the Father, Son, and Holy Spirit. Amen.
Pledge allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Secretary, would you please call the roll?
Mr. President, Dr. Pinner. Here. Ms. Booker.
Here.
Mr. Stokes. Here. Dr. Mitchell. Here. Dr. Marbury.
Here.
Dr. Hicks. Here. Ms. Giles.
Here.
Mr. Brooklier.
Here.
And Dr. Cobb.
Here.
President, all members are present.
Okay, so we have a quorum. Do I hear a motion to adopt the agenda?
So moved.
Second, Dr. Cobb, I'd like to add a communications thing in in old business, I guess.
Okay.
Just to.
All right, so I've got a motion to accept the agenda. I need to get one, with edit.
Okay. I move to accept the agenda with the edited items.
All right,
I'll second that.
so I have a motion and a second. How do we vote?
Aye.
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 And I vote yes. We've adopted the agenda. The first item, on our agenda will be the minutes, so we need to look at the February 2026 business meeting minutes, and those are in your Dropbox under minutes.
There's a date error, page 7. Says comments are due. This is based on last meeting. Comments are due by March 13th. I think that's supposed to be April 13th or April, whatever the right date is in April.
What page is that on, Jeff?
Page 7.
7, I'm sorry. Thank you.
What's that date supposed to be?
Should be April the 13th, probably.
It could be May.
Would it be April or May?
It might actually be March. Depends on when it was actually printed.
Oh. No.
Your public hearings for today.
Yeah, it should be March. Probably be April 15th.
Mr. Secretary, you verifying that date for us?
And one other procedural matter, Mr. President, the agenda reads February minutes, that should reflect March.
You are correct.
Instead of February 2026.
Thank you, Judge, for that pickup.
April 10th.
April 10th.
For a public hearing on 4/15, and that would apply to dot 37, dot 36, dot 23, 1 dash dot 02, 1 dash dot 01.
That should also be listed as 1-01. It's got 2-01
It's titled organization.
organization, yeah.
Yeah.
It should be 1 dash dot 01.
So need to correct that on the date before we can.
All right, are there any other corrections for the minutes? So I'll entertain a motion to accept them as amended.
So moved.
Take a second. I have a motion and a second. How do we vote for the minutes?
Aye.
Aye.
I,
Aye.
sorry.
And I vote yes. All right, if you'll take a look at the interview minutes from March 18th. All right, are there any edits or amendments to those minutes? Hearing none, can I get a motion to accept the minutes for our interview day? A motion.
Oh, so moved.
Second.
I have a motion and a second. How do we vote?
Aye.
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 All right.
And I vote yes. All right, that takes care of our minutes. We're moving into presentations. The first presentation today is from LMC Med Consult LLC. You'll step up.
Yeah, do you have to swear her in, Sherry?
Ma'am, will you raise your right hand, please, to be sworn? Do you solemnly swear or affirm that the statements you are about to give will be the truth, the whole truth, and nothing but the truth? Yes, ma'am. Thank you.
Thank you, Mr. President. Thank you, board members. My name is Evelyn Senwo. I'm presenting on behalf of LMC Med Consult for a pharmacy services permit. My agenda for this presentation today includes the importance of pharmacy services permits, the background and rationale, scope of practice, operational model. We have policy and procedure and the benefit to the healthcare system. Pharmacy services permit, of course, is linked to reduce medication error and to increase patient health outcomes and safety. The background and rationale why I'm doing this. We all know our healthcare landscape has continued to evolve with advancement in technology and telehealth. So pharmacists are in a position where we can increase both our patient outcomes within our community in which we serve. When I look at the National Healthcare Expenditure Report that was provided in 2024, it showed there was an increase in 7.2%. That was $5.3 trillion. And pharmacists were in a position where we can be innovative in order to bring down these costs. And also, when I look at the Health and Human Services report, it's saying that by 2036, there's going to be 139,000 shortage in prescribers. So pharmacists, we have to fill in this gap and help the patient in which we serve in our various communities. When we do work remotely as pharmacists, we tackle so many issues. We have patients who have challenges in mobility challenges. We deal with patients who are homebound, the elderly patient. We do increase healthcare accessibility in patients who live in rural areas and underserved communities. We support public health initiatives during times of public health concern like we had during the pandemic. So I think pharmacists, we have to play a vital role in helping the community in which we serve. The scope of practice, the service I'll be providing, we have the medication therapy management, which I'm going to be collaborating with independent pharmacy in order to do their cases of medication therapy management. Do collaboration with primary care physicians so that we can do chronic care management. We can do nutrotherapy consults, remote physiological monitoring, that's remote patient monitoring. The healthcare industry is leveraging in this patient monitoring because it helps to increase patient health outcomes, mostly patients who have chronic diseases. So I think that's the future of the healthcare. So we have to give our pharmacists the opportunity to be able to serve our patients within our community. We also have point of care testing that pharmacists can do. Of course, during the pandemic, we were highly involved in doing those services, mostly the clear wave tests. Again, doing medication therapy with independent pharmacy. Also do immunization recommendation, doing community outreach. I've been so involved in community outreach, meeting with self-insured employers within the community in which we serve. We can do even the medication therapy management, we can do immunization. This will help the employers, their patient or their employees to be provided, to be prevented from flu, COVID, pneumonia, and all the different immunization that we have. So this will help prevent hospitalization for their employees. Patients will be prevented from all those preventable diseases. So I think pharmacists, we should be able to give pharmacists this opportunity to be able to independently partner even with healthcare plan. There are other states that they are trying to see how pharmacists can be innovative. If we don't do something different, our healthcare expenditure is going to be rising. So something has to be done. And pharmacists, we're in a position where we can really help our patients within our community. We can look at health risk assessment, looking at the social determinant of health. There are so many patients that they don't meet their health outcomes because of different risk factors that they might have. So as pharmacists, we can always address those and help the patients see how they can meet their clinical outcomes. The operational model for what I'm going to be doing. We always say that pharmacists are expensive. So most practices, they don't want to hire pharmacists full-time. So it's going to be like contract basis where pharmacists can meet with providers once a week or twice a week and deal with their patients who have chronic disease states, help them in order to improve their quality metrics. Or maintain documentation and give patients a copy of the intervention and documentation that has been done by the pharmacist. We also have the policy and procedure. I do have a separate handout for the policy and procedure I have emailed to the board about what are going to be the standard operating procedure that we're going to be following here at LMC Med Consult. What's the benefit to the healthcare system? It's going to increase the quality outcomes for our patient and quality of life because by pharmacists intervening, they're going to be meeting their clinical goals. To improve quality metrics for providers and increase incentives pay for Medicare. We all know about the value-based care now system. So providers are being reimbursed, paid because of these value-based metrics. So we have to help them when we do pharmacy integrated value model by meeting with the prescriber, help them with their chronic disease patient. To improve medication safety and reduce adverse drug events, or prevent complications that patients might encounter from their medication use. The pharmacists are right there to meet the patient where they are. It's going to help our community. It's going to help the patient within the community in which we serve, because we really have to be part of that healthcare problem. We have to do something to help our patient within our community. We're going to support the healthcare team through expert consultation and education as pharmacist experts. These services will be provided within the scope of pharmacist license and in full compliance of the Alabama Board of Pharmacy regulation and state laws. Thank you very much for your consideration of this request. I am confident that on-site and remote pharmacy services provided by pharmacists is going to enhance patient care and support the mission of the Alabama Board of Pharmacy. Thank you very much. Thank you for your time.
All right, are there any questions from board members?
Yeah, so you're working with independent pharmacies, is that correct? Is that what you said?
The model is to work with providers and independent pharmacists to do contract with them.
Okay, so how do you incorporate that individual's pharmacy? Because, I know I get recommendations from MTMs and various other things in my industry that come from an outside source that's done this. I don't know that the actual house doctor or whatever has signed off on this, and then we're just getting, this fax coming over. So the pharmacy that does dispense those medications wasn't intertwined in all this. So how is that pharmacy supposed to help this patient if they're on the outskirts? And how do you plan on, incorporating them in the health?
Yeah, within just like the other chain pharmacy, they have access to outcomes. So if I can contract with the independent pharmacy, I can do the cases to the outcome platform. Then with the providers, we're going to be doing more so of chronic care management with the providers. But with the independent pharmacy, it's through the system where the outcome we can do MTM services for their patient. Because sometimes they might not have time to do that. Because I've seen where pharmacists don't have the time to incorporate MTM services and the normal workflow. So if you can contract with an independent pharmacy to just do 1 day a week, you can handle all the MTM cases.
So, see if I understand this right. So when you contract with the pharmacy, you're taking their patients, their MTM opportunities and doing it for them when they don't have time.
Yes, sir.
So that answers most of my questions. Your patients come from the pharmacy's database and your contracts with the pharmacist. And then you talked about some collaborative practice agreements. How do those work? How does that intertwine with the pharmacies or is the pharmacy in that mix in your collaborative practice, or you have your own pharmacist or yourself that's doing that?
It's going to be our pharmacists contracting with the independent pharmacy to work on the MTM. The collaborative practice agreement is going to be more so with the providers. I have an interview, actually, a presentation with my collaborative physician on Friday to see how we can do that. So The collaborative practice agreement is going to be with the providers to see how we can do the patient on chronic care management, even the remote patient monitoring is through collaboration with the primary care providers.
So so it's two programs. One is through Independence, and you're getting the patients from them and taking care of those patients from that perspective. And then you're going to the physician and doing this about the same thing through their patient base, and that collaborative practice between that physician and his patients to you. Makes sense?
Is there a physical location that you'll operate from?
Yeah, so right now I'm still working with the prescriber to the archive before the board will come to look at assess the spots. I'm still working with the provider to have a spot.
Any other questions from board members? Any questions from Secretary Lena or council? Concerns? Okay. So at this time, I'll entertain a motion to approve a pharmacy services permit for LMC Med Consults LLC.
So moved.
All right, I got a motion. I think I heard two motions, so I have a motion and a second.
Second.
Okay. So how do we vote?
Aye.
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 Aye. And I vote yes. Thank you. All right, the next item on the agenda is our treasurer's report. You.
Real clear. Okay, some points about the fiscal year financials for the period covering October 25 through September 26, month ending March 31, 2026. Total revenues for the fiscal year are at 75.44% of annual budget. Operating expenses for the fiscal year were 45.75% of annual budget amounts. Some sub-account numbers from the financials, licensing fees revenues are 75.81% of the budget projection. Fuel costs are only slightly above the budget and expected to settle above budget for the year. All of this and much more will be posted on the website. And as a point of order for myself, for future treasurers, I'm working on an informational sheet, a spreadsheet that takes each one of our expenditures, checks written for the month, and documenting what they're for. So that you don't have to call the staff and the accountant every time asking who this vendor is and what exactly are they giving us. This will explain. Particularly good for the monthly stuff that automatically comes up. But then it also, you can look at, are we spending too much on this and too much of that category, that sort of thing. When you come in as treasurer, if you haven't been before and you don't know all the little details, I'm thinking this spreadsheet will help answer a lot of those questions. John and the staff have been very patient with me with all of my questions. So has Millicent and Mr. Driscoll at the CPA firm. Anyway.
Yeah, I can say for sure that that spreadsheet would have been very helpful in the first couple of months as treasurers, you trying to figure out what you're paying and who you're paying it for, what you're paying for. All right, do I hear a motion to accept the treasurer's report?
So moved.
Second. All right, motion and a second. How do we vote?
Aye.
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 And I vote yes. We need onto our wellness report. Who's? Go ahead, Investigator Shaw.
This is a communication from Dr. Garber dated 4/1/2026. Follows is the monthly report of current work of the Wellness Committee. All of our folks presently being monitored are without complaint and their screens have been negative. On the current work, there are 7 pharmacists in process at this time, either in treatment or being held out or going for evaluation. There are 2 pharmacy techs in process at this time through residential treatment or being held out or going for evaluation. 2 pharmacy techs in process at this time with no return contracts. There's 1 pharmacy student in process at this time and residential treatment being held out or going for evaluation. 3 pharmacists having hearings at this board session. We have 1 pharmacy student having a hearing before asking for a license. Outside of this number, we have 43 pharmacy health professionals who are being monitored. This is to be expected for the number of licensees. It is up slightly from last year. Thank you, Mike Carver.
Any questions? All right, moving on to the chief investigator's report.
Thank you, Mr. President, members of the board. The Chief Investigator's Report for March has been uploaded to Dropbox for your review. Contains comprehensive statistics related to inspections and investigative activity conducted during the month. During March, investigators completed 165 compliant inspections. 1 inspection resulted in an observed violation rising to the level of generating a complaint or possible statement of charges. The total number of inspections conducted by investigators from January 26 to March of 26 is 384, resulting in 1 violation noted for review by legal for possible statement of charges. During the same period, the board received 18 complaints and 29 investigations were completed. Year to date, a total of 66 complaints have been received. Of those, 4 have been referred to legal counsel for further review regarding potential violations of the Pharmacy Practice Act that may result in an issuance of statement of charges. Since the last board meeting, 2 pharmacy burglaries have been reported occurring in the northern and middle districts of Alabama. ALBOP continues to encourage all licensees to maintain situational awareness and to promptly report any break-ins, suspicious activity, or criminal incidents to the board. During March, ALBOP investigators completed firearms training and successfully achieved annual firearms recertification. Investigators also attended continuing education on use of force and provided presentation to P2 students at Sanford University regarding the enforcement role at the Alabama Board of Pharmacy. As an update on recently purchased investigator vehicles, we've received an estimated delivery timeframe of 30 to 60 days for the 2 ordered Dodge Durangos. Additionally, a case review committee summary for the past quarter, this will be from January to March of 2026, has been uploaded to Dropbox. My thanks goes out to Dr. Anderson, who prepared this dashboard. This outlines the findings and resulting board orders for cases presented to the committee during that time frame. And that's up on the screen at this time. So a total of 58 cases. And for 30 of those 58 resulted in no violation or no action. 9 were corrected or educational letters went out to them. There was 1 surrender, 7 surrenders. Apologize. Let me correct that number previous. For year to date, for the January through March, for corrective measures and educational letters sent out, there were 17. Surrenders were 7 in that time period. The escalated would refer to possible statements of charges, and 1 referred to other agencies.
Thank you. Along these same lines, I looked at the last 4 years of all the cases that came in. This is from January of 22 through December of 25. These numbers are kind of holding steady. When I look at no violation and no further action, that was about 60% of our cases. Letter of concern went out in about 14% of the cases, and about 7% of them were referred to another agency. So I think, we need the public to understand that just because a complaint's generated doesn't mean that a statement of charges is coming. And I think that that perception may be out there, and that's not accurate. There's a lot of letters of education, letters of corrective action, like I said, was 14%. And that was letters of concern, letters of corrective action, or not including warning letters. I think maybe 2% or 3% had warning letters. So I think there's a lot of activity that goes on that the public doesn't see in trying to provide education and then also clear out complaints. And as the board knows, there's a lot of complaints that our investigators have to evaluate that are really not related to anything we regulate. It's more customer service in some cases.
Yes, sir. If it would please the board, I would like to, with the help of Dr. Anderson, continue to provide that quarterly to the board and the public to be able to view.
I think that would be great.
Yeah, we really need to do that. And that was something that we've talked about in general over, particularly when we're talking about civil penalties and all that, and everybody's thinking it's all money, it's all money, it's all money. And, you know, I've been preaching that it's not, you know, they're the numbers. The public just doesn't see it with that report. And if it's maybe posted on the website or something like that, then the public can see that vast majority of the cases, there is no money. Thank you. And thank you, Dr. Albertson.
All right, moving on to the next thing, Executive Secretary's report.
Thank you, Mr. President, members of the board. Since our last meeting, once again, there have been no reported pharmacy closures statewide. We have that 2 months in a row. We were able to join a meeting of the Alabama Opioid Overdose and Addiction Council in Montgomery. We're a member of that council in the dispensers and prescribers committee. There I was able to meet with counsel for the Board of Medical Examiners. During that conversation, we discussed our shared concerns in Alabama with administration and dispensing of gray market GLP-1 peptides in med spas and other practice settings. As you know, that's a space that's fraught with issues where the jurisdiction is unclear in the supply chain. And certainly more work is needed between BME, nursing, pharmacy, and any other agency that will talk to us about that. On a related note, FDA has announced increased scrutiny of GLP-1 compounding under CB. FDA points out tirzepatide and semaglutide do not appear on either the 503B bulks list or the FDA's drug shortage list. Therefore, outsourcing facilities should not compound tirzepatide and semaglutide from bulk API. Compounders dispensing under Section 503A should carefully review the FDA update to ensure they're operating with the allowances of that section. So for those who are less familiar with 503A and 503B, 503A is pursuant to a prescription for individual patient need, and there are some allowances under FDA, but there are guardrails in place that compounders should just be aware of so that they're communicating with their prescribers correctly. Also at the OAC meeting and on a separate call with ADPH, APA, and a licensee, there's been discussion of PDMP challenges and opportunities specifically with Title 20 to 214 that allows PDMP access for pharmacists with no allowance for delegates, meaning there's no provision currently for pharmacy technicians to access PDMP during workflow. Based on all those conversations, all the parties understand the value of expanded access to PDMP in pharmacies, but legislative action is going to be required to change the level of access allowed by law. By comparison, physicians can have a couple of delegates who work in the practice who access PDMP on their behalf. That's absent for pharmacies. Similar information that I've shared in prior months, pharmacies are required to submit to PDMP in most cases. They'll get submission error reports from Vicki Walker at PDMP. And they should respond to and correct issues from those emails. The most common of which are missing or invalid prescriber DEA number, missing patient address, missing NDC and quantity of controlled substances in compounds specifically. And of course, all pharmacists are encouraged to create a PDMP account, and they can do that at alabama.pmpaware.net. A reminder, ADPH has announced different plans for their substance misuse summits in 2006 rather. They've moved those from Montgomery into two separate meetings in August, one in Mobile and one in Huntsville. Those are available under both the PDMP pages and the ADPH website. Another reminder, Department of Insurance has changed a number of things, including an updated fax number for reports, and updated complaint forms that everybody should be using to submit their PBM complaints, a complaint best practices document that will help facilitate that complaint resolution, and a reimbursement complaint spreadsheet to help alleviate some of the confusion about which portions of the reimbursement transaction need to be included or not, specifically the provider tax, the prescription tax that pharmacies pay should not be included in those calculations. The board continues this month to receive reports from a few pharmacists about email solicitations and online job postings for inspection and credentialing only. This is that situation that a company is recruiting for a pharmacy to use a pharmacist license to handle the initial ALBOP inspection and then to use those credentials for billing purposes. That's not allowable in Alabama. There's no such thing as a sort of credential-only role with no operational oversight for a pharmacist. So if you're not on site for the work that a pharmacy is doing, then they should not be using your credentials to bill for that work. Pharmacists should remain aware of this and pop-up scam pharmacies that hire a local pharmacist, bill thousands of prescriptions to third parties, disappear overnight without ever receiving inventory. And Dr. Alverson and I've had some conversations, and she will be organizing a compounders roundtable to provide a forum for that practice setting and to discuss challenges and trends in that space. Any practitioners in Alabama interested in participating in that roundtable should reach out to Dr. Alverson at the board office. I didn't tell her I was going to say that, so just making sure I didn't step in anything. And board staff are actively preparing for our upcoming legal compliance audit with examiners of public accounts. EPA will be on site for our entrance interview next week. And in the interest of time, I'm not going to run through the bills. The legislative session has ended. Final disposition of some bills that we've been monitoring are in the report Dropbox for you to look at. They'll go out with the exec email as well. The notable ones that have been enacted and assigned act numbers, of course, is SB 100. That's our 2026 sunset bill. And SB 40, which is related to contract review and allows the contract review committee to recommend to the governor that a contract presented to them not be signed. Aside from that, that is what I have this month, Mr. President.
Right, thank you.
What can we do on the PDMP side to allow staff to be able to see that? It would be a tremendous help for all of us to allow techs to, give us a heads up on those kind of things instead of the pharmacist having to do that.
I think we'll have to collaborate with APA and ADPH on a legislative change package. So it'll have to be in a bill package for the next session because it is explicit pharmacists and that's all. So it would be a statute change to allow anybody other than a registered pharmacist to have an account.
And who do you anticipate would be opposed to that?
I don't think anyone. The conversation as we had it with ADPH really comes down to funding of the program, cost of implementation for any changes. There's some fiscal analysis that will have to be done on their end for programmatic changes. But in the conversations that I've had, nobody thinks it's a bad idea. Data security is a big issue. Obviously, the way PDMP Access works today, it's an individual accesses the database and they can do that on the PDMP website anywhere that they are. So that access can occur outside of the walls of a
licensed pharmacy. I've had some preliminary conversation with Rachel Kiefer about whether that we could discuss tying PDMP access to an NPI or DEA number so that it's from a physical location of a pharmacy and done within that pharmacy information system rather than individual to individual, because physicians may work sort of wherever they are, but most pharmacists are going to be working within the walls of a registered location that already houses HIPAA secure data. So the data security might be superior if you tie it to the business entity rather than the individual practitioner. I think that's just got to all be part of that conversation. But nobody said, no, we don't want to expand access to PDMP. It's pretty pivotal in decreasing our, total opioid prescribing, our morphine equivalent prescribing over the years. That's data that came out at the OOAC meeting, as that trend continues to fall in Alabama. At a similar rate to other states, which means we're still, higher than a number of other states, but, we're reducing prescribing of opioids at a similar rate to other states, and everybody wants to see that continue.
Thank you. All right, any other questions for Secretary Lenham? All right, not hearing any, we'll move on to the attorney's report.
Mr. President, if I could just add to the question that Mr. Brickleyer asked a second ago. I know that maybe 2 sessions ago, dentists got statutory authority for delegates to be in PDMP. It's not controversial at all. I think that's something we could easily do. I think you guys are going to hear from me plenty in the rest of the agenda, so I don't have a report for you today. But we'll have plenty to talk about as the meeting goes on. Thank you, Council.
All right, moving on to old business. The first item on old business is rule .34 and .35 licensure fees for pharmacists and pharmacies. Last month, we withdrew certification for 680. Is that correct? We
withdrew the certification.
Withdrew certification for 680, that's right, correct. 680X-2.34 and 680-X-2.35 to add business impact analysis for each. Those are located in your Dropbox. If you'll review those.
President?
Yes.
There's actually something I'd like to add to that. We did pull those so that we could do business impact analyses. As Dr. Nolan and I were looking at that during a break in the meeting last month, we saw that there was an allowance for an exception that the Legislative Council could grant. We just didn't know if we had it. We have since heard from LSA that we do in fact have that exemption, and that document is in your Dropbox as well.
What's it labeled?
It's February 14, 2014.
It should be miscellaneous communication.
Miscellaneous filing.
OB1 exemption, it's the third or fourth one down.
Go to like the third or fourth page. There you are.
Third OB1.
It's the third or fourth page of that. Most all boards have this. We just didn't know if we had it or not. And it's on down. There you go. P, pharmacy. There we go. So we do not actually have to prepare and file business impact statements under section 5.1 of the APA. They're there if you want to use them, but I just want to advise you that in fact, you're actually not legally required to submit those. You can recertify 0.34 and 3.5 with or without those statements.
Is there a recommendation from council?
I think if it was up to me, I would not. I'm always for more transparency, but if we're not legally required to do it, I don't see an advantage to preparing and filing those. There's other things that we can do on a voluntary basis, but we're clearly exempt from that section of the statute.
So, how do we need to mark future submittals? Since there's not an option, it's a yes or no question. There's not a box for exempt or not applicable.
That actually refers to a different part of the statute.
Okay.
The 5.1 business impact statements are triggered not by our checking of that box, but by comments that we receive from businesses. And so it's separate from the fiscal note, which is what you're referring to.
So on the submittal, the question on the submittal where it says, is there an economic impact? That has nothing to do with this.
That has nothing to do with this specifically, right?
So So if we receive public comments that triggered that, then why would we not want to submit that with the rule change?
It's up to you. It's up to you. I mean, I'm telling you, it's not required.
I guess we marked no on the transmittal sheet, that there was no economic impact.
Right.
But I guess arguably there is an economic impact if we're increasing charges to licensees. So I guess how could we mark that no if we knew that the rule is increasing fees? How can we say that's not an economic impact?
Now, that is something that we can have more discussion about in future rulemakings. For me, so the yes or no on that triggers what you're referring to, triggers a fiscal note to the legislative council. The legislative council certainly could, if they disagreed with our yes or no there, could certainly come to us and say, hey, you know, why don't you send us a fiscal note? And we'd absolutely do that. When I look at what is actually in the fiscal note though, and again, this is probably more of a discussion ongoing. But the kinds of information that it asks for really doesn't mesh with the fee increases. It's things like, what is the effect on the environment? What is the effect on competition in the marketplace? What would be the cost for compliance? I mean, you can kind of look at it and go, okay, it's going to be another $12 a year. Do you really need a fiscal note for that? The legislative council doesn't seem to think so. Obviously, if we hear from them to the contrary, that, and again, more of a discussion we can have about that. It's a bigger topic.
I'll say too, there is some automatic review that happens to Board of Pharmacy rules. Because you're a board of licensed professionals, there's an anti-competitive review that rule submissions go through. And we receive that communication from those groups as well when they
That's right.
determine that it's not anti-competitive.
That's all part of the reason why rules don't go into effect until 45 days after they're published as certified is so that those committees can look at the proposed rule, not proposed rules, but certified rules. Yep. There's a little bit of method to the madness.
All right, any discussion on whether we should certify with or without economic impact? Anybody feel strongly one way or the other?
What would be the cost to the board to do an economic impacts study? I mean,
Well, the study, econometric studies per se are not required. These that we prepared, it was not particularly burdensome. We sat around the table and collected numbers and put them into charts. The documents that you see there, it was not particularly burdensome.
So the work's already done.
Well, on these two, it is. And it's something that we can do and post on our website without sending it to LSA. I mean, there's options that you have available to you other than filing these as though they're required.
So we're adding an extra air of transparency if we file them, especially since they're already done.
Sure.
So then I would make a motion that we file with. There's no more discussion.
Got a motion to file with?
second.
All right, got a motion and a second. How do we vote?
Is this motion on just this one or on all of them? I don't want to see our staff spending all this time on economic impact for $12.50 a year.
I think this is just on 3,
It's
4,
just
and 3,
these,
5.
yeah, I think, so what we're voting on right now would be, I'm gonna restate for the record,
Sure.
if that's okay.
Sure.
To certify 680-X-2.34 and 680-X-2.35 with the economic impact study as already presented.
This impact.
Business impact study as already done.
I'll vote yes on that.
Well, I want to make sure that I captured the motion correctly. Is that,
Yes,
Okay.
yes.
all right, so I've got a motion and a second.
Yes.
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 Aye. And I vote yes. All right, that'll move us on to the public hearing, continued public hearing of 680-X-2.50 civil penalties and 680-X-A appendices. Today would be the continued public hearing of 680-X-2.50 civil penalties and the appendices and a proposed new rule to develop civil penalty schedules as mandated by Act 2025-372. We did not receive any additional comments since last meeting. Officially, I think we've all received some comments individually, in not necessarily in the group public fashion. Again, I would like to try to take this as two separate items and not one item, as so we can be effective in our communication. So the first item I would like to take up is the text of 680-X-2.50. And the question, I think, to the board today is, shall we certify it as amended last meeting? Is that correct, council?
Yes, sir. You actually have two separate rulemaking proceedings in parallel.
Yes.
One is the front text that we worked on last month, and the other is the appendices, which is where your fine schedules are, all the charts.
So to be clear, do we need to certify the text, or is the text per the vote and edit last month clean without a vote, or do we need to vote on that?
If it's the board's pleasure to certify the front text of .50, you would need a motion, second, and vote to do that. I feel pretty good about the current status of that front text. And so I think that's something you could go ahead and do. I think the appendices is a bigger conversation, but if we're just talking about the front text right now, you would need a motion and a board action to certify this language as amended.
Okay.
Excuse me, where is that on in our old business? I can't find that. We got up there.
The second
Six
under
down.
OB2. It's under which section?
It's about 6 down.
In old business. Old business. Yeah, it's the second OB2.
3, 4, 5,
So what it's showing is not the clean copy, it's showing it as modified from last month.
Okay,
correct?
okay, the sixth one down.
It's a-
That would be
Correct.
Yeah, and so just to be clear, the modifications and the edits have already been accepted. We've already voted to do that. So it would be accepting this as written, not as modified. We've already accepted as modified.
You've adopted these revisions to the draft? Yes. So certify as shown on the screen.
Any discussion on .50 text?
Make a motion, we approve it.
Okay, I have a motion and
Second.
a second. How do we vote?
Aye.
Abstain.
No.
And I vote yes. All right, council, I'll let you lead out on the appendices.
Well, like you say, I know we've all gotten a lot of comments about the fine schedules and the appendices. And what I'm thinking about is, what is best for the agency and what is best for the public moving forward. It struck me, the discussion that we had last month on this was that there's still a good bit of work to do on the appendices, the fine amounts. And we started and made some progress on it, but what I would like to see as an agency, as a board, is a greater level of consensus and more discussion and more work so that we're all more on board, more on the same page on what the fine amounts are going to be. I think that we can definitely get there. I don't know that we could get there today. My thinking about the appendices, the fine schedules, was to let this die today and not try to certify it, not try to work on it today, but instead for the board to perhaps appoint a committee, the sole purpose of which would be to work on this outside of board meetings, not have the authority or power to actually decide or dispose of anything, but simply to work on it, engage the public, engage each other, work on it, get this in shape, then bring it back in a new rulemaking. So we'd bring it back, start a new public comment period on this, get public comments again. Essentially do-over on the schedules with the committee. That's my thinking.
And we could have 4 people, correct, so we wouldn't have a quorum?
You can have as many as 4 people and not trigger the Open Meetings Act as long as it's clear that that committee is not empowered to actually dispose or decide anything. It's strictly advisory, strictly a working committee to work on drafts that would 100% be brought back to this board for public deliberation, new notice and comment, new rulemaking.
Is there any discussion on proceeding that direction with the chart?
I guess my question would be back to, I know we just passed dot 50. To me, there is a high likelihood that in that committee with that public input, that there may be a strong desire to change components of the text of dot 50. So, similar to what we're going to discuss in dot 40 soon, I feel like there are a lot of components that cannot be fit into the appendix. So since there's no value in dot 50 being passed without the corresponding fine schedule, my recommendation would be that we would withdraw the certification of dot 50 and let that committee work on all that together. Because again, from what we heard from the public comments, trust is very bad. What we're going to talk about later with the letter from the legislative council chairs, there's input that we're not meeting the intent of 123, whatever that corresponding act number is. So I think we would all be served better long-term to do the committee with dot 50 and the appendix together.
Well, I think, I hear what you're saying. I think we've already decided on dot 50, so that's kind of mute at this point.
We can still,
But
we can withdraw it.
so hear me out. So I think as the group, if we were to put a group together, which I think is the way to go, because I think 9 of us trying to hash out a fine schedule in a public open forum is going to be very cumbersome and it's going to be very slow. And I think from a efficiency standpoint, if we can put a 4 people together who can come back to the board with a workable document that we can all work on. And I think we all realize that there may have to be some changes to the 5.0 text when that comes. But I think we're also not well served to throw it out, considering that it for the most part lines up with what we want in the expectations of 1, 2, 3. There may be some edits. Personally, I like the idea of trying to put a group together. I don't necessarily want to have big public meetings because I don't think those will end up being productive. I think at some point in time when you have a workable document, public comment is great. I think while you're trying to get the working document, too many voices becomes problematic. I also will tell you that in some of the comments that I've gotten, I think there is some disconnect with what we're charged to do and what people are seeking us to do. What we're charged to do is come up with a fine schedule. And if you remember last month, in the appendix, we went ahead and knocked off all of that last column that had probation, suspension, et cetera, et cetera, et cetera. Because what we've been charged to do in this exercise in statutorily is create a fine schedule. Not necessarily to create a schedule of all of the things that we could potentially do as a corrective action. So just because there's a fine schedule doesn't mean that we don't do a letter of concern or a letter of warning or a letter of education or ask for you to do CE or probation, suspension, or revocation, whatever is appropriate for the infraction. So I think we've got to narrow our focus, and I know that there's some desire to have something written that says, if you do this, then we're going to give you a letter. If you do that, then we're going to give you a letter and a warning. I would caution us in trying to get too prescriptive. And if you've been around a while, you've run into some situations where there have been things that have been prescriptive, and it doesn't feel like there's a lot of prescriptive stuff in here, but every once in a while you run into something and there's a case where this board wants to provide as much mercy as we can, and we have no mechanism to do it because our hands have been tied by some rule we've written. And it's what our former president Fung talked about, unintended consequences. I mean, I give you an example of a lady who permanently surrendered. And one of the reasons now why we hear and approve surrenders is because we had a person who permanently surrendered in a bad part of their life, couldn't go do the things they needed to do to get well. and then came back 10 years later, and there's no mechanism for us to undo that. And so I just, I want to be careful about what we're charged to do. And maybe there's a time and place to come back and say in a guideline or in a policy that says, this is kind of stepwise what we do, and we can publish that. And I think that would satisfy a lot of people. You know, if this is the infraction, this typically gets a letter of warning or a warning letter, this gets a letter of concern, et cetera, et cetera, et cetera, et cetera. This moves on to a statement of charges. I think there's a place to do that maybe in policy, but I just caution the members in making something so prescriptive that you have to do something to someone, fine them or penalize them in a certain way when the facts of the case don't really warrant, I mean, they warrant it on the facts, but then the circumstances around it, you can't provide some mercy. And I don't want us to make inadvertently life harder on people while we're trying to be transparent, and that's my concern. And so I'm gonna get off my soapbox, but I do think we need to talk about, is there any concerns? Is everybody good with trying to form a group? Who would be willing to serve on that group?
And before we get there, Mr. President, I would just acknowledge your comments and say I certainly understand and appreciate, the concerns of not being too prescriptive, but I do not necessarily think that they're mutually exclusive. And whoever the 4 members are on that committee, that is the one consistent that we are getting from all of the comments. So I would encourage that committee to try to at least incorporate what that looks like in 0.50, right? We don't want to get too prescriptive, but that is the one consistent comment that I've been seeing. So I would encourage that 4-member committee to at least consider how those two things can go hand in hand, because I don't necessarily think that they're mutually exclusive.
I don't either. I think, Judge, when you do that, you always have to provide yourself an avenue for some leniency and some grace. And I'm not gonna be on that committee, I hope. So, I charge them with that challenge, or we would charge them with that challenge if that so pleases the board.
And I agree with everything that you said about, like, I don't want to force anybody down the path. But then I also want to provide reasonable guardrails that people are handled equitably by this board and future boards. And so and I would love to be a member of that committee. Y'all may disagree, may kick me out, that's fine. But what I don't want to do is be on the committee, and my ability to provide what I feel like is the best document reflective of the profession to be constrained by restrictions in .50, not knowing if those are going to be rigid and unchangeable, that I'm going to spend, because this is something, I mean, I've already spent literally days working on this as volunteer. We don't get paid for anything we do outside of here. So this isn't running up payroll. But I've taken days of my life away from work, family, whatever, to make this better for the profession. So I feel like if we'd had the conversation on the appendix in the committee before we voted on .50, we might have got a different vote from the members, knowing that this was going to be an option.
Well, Dr. Mitchell, any rule we write?
Yep.
Is that, okay?
But again, if I'm working in committee, not knowing if there's going to be a majority to change it.
I think,
And can I ask Aaron?
I think if you have a recommendation, if the committee comes out with a recommendation, I think there'll probably be comments from the rest of the board. But I think they're gonna accept, by and large, I hope, what you guys come out, or whoever comes out with a working document.
So essentially, if we get rid of the appendix and start over essentially, we can throw this complete format away and start over with a whole new document. As long as it's
Well,
not
maybe.
contradictory.
Not the
It has
format.
to follow the statute.
Well, yeah,
I want
yeah,
to make sure
for
that we're clear
for
about
sure.
that.
We have to follow the statute. But we're not, can we do first offense guidance, second offense guidance, third offense guidance? Or does that have to be identified in dot 50 to allow us to do that in the appendix?
I think the appendix could provide for that.
And so that's my question for legal counsel.
And it could be in the appendix and/or there could be language that we work on in the text to go together, right?
So can we pull up dot 50 again real quick on the screen?
Well, and Dr. Mitchell, I would also tell you, we went through several different formats prior to coming to the format we had. And we were advised by AG office at the time because I personally liked the format that Ms. Jones provided, where you had, I thought it was a whole lot easier to read. We were told we had to have separate schedules. They could not be
I agree
combined.
with that. And I know what you mean by that.
And so there are some limitations as far as how the schedule is structured,
For sure.
unfortunately.
So, Aaron, you're saying now that we're gonna be able, on a schedule, like on the, the schedule as it is, we're gonna be able to put comments about first offense, second offense? Before, we had that maybe back in February. We had something that with some statements, some caveats attached, and I thought we said we couldn't
Well,
do that.
we said we were gonna take off, that what we were charged to do was a fine schedule. And so we were taking off the probation,
Yeah,
all
that's,
we were taking those things off. I think the fine, what I'm hearing is, as part of the calculation of the fine schedule, we would include potentially some sort of matrix on how that would be calculated based on the three things that we are supposed to be looking at. So I think I'd like to keep our discussion to right now. Do we want to form this committee or not? Because I don't want to get us off, I'm trying to hold us on to a task. So is there any more discussion on forming the committee?
I don't want to be on a committee in which I don't have clear guidance.
Absolutely.
And that's my problem, is I don't want to go and do all this work and then come back and say, oh, well, we can't add those things. So that's why I'm just trying to get
No, so I don't,
what we're truly gonna be tasked with, if that's gonna be an option to put first offense, second offense.
did you state the task?
The task is to create fine schedules for disciplinary violations by violation and separate it out by license type. That's the statutory charge. And I think what you're getting at, Dr. Mitchell, is good and right. You're gonna have a fine schedule, but then you have the real question is, when the rubber hits the road, where are we gonna land in here? Is it gonna be 0 or 5,000 or 10,000? I should say 0, 500 or 1,000. Okay,
Exactly.
right? Okay. And to an extent, those are separate tasks. However, I do think it would be permissible for the board, if you want to create the matrices in such a way, the appendix in such a way that you have one column for first violation and another column for second violation. I think that is still a schedule. That is still a range, right? But the statutory task right now is to create the ranges, okay? So maybe the thing, and I know we all want to get this done and get it finished, but is there a way to maybe simplify the first task and then work on the second task?
Well, so I think I guess that's what I'm asking is,
Right.
is it am I just looking around at head nods before we get too far? Is everybody in agreement, or at least with the thought process of, we'll put a task group together that can work together to come up with a working document to bring back to the board in, let's say, 2 months in June?
And and I guess my participation, or my agreement to participate if I'm chosen, will be contingent on knowing what resources of the board this committee will have. Because when I look at, for example, the technician section that we eviscerated last meeting, on this fee schedule, fine schedule, there are many items that we agreed we would never charge a tech for. And we have, I've said this in multiple emails, we have centuries of experience at the board with determining what violations are applicable to different entities. So I don't feel my role as a board member or as a committee member should be to start with zero resources when I have past executive directors here acting and I have all the investigators' years of experience. I have Crystal, I have, again, I won't name everybody who works at the board, but I've asked for the last 3 weeks through emails for help on this with no response from John, from you, from Tommy. So if I'm on this committee, what resources do I have and the other 3 members have that we're not just solo and we're gonna end up with a pile of crap like we already have?
And I don't think that the resources of the committee can be limited. I don't think that your resources as a board member, full stop, should or can be limited. But certainly as a committee, I don't think that there should be any guardrails on what the resources of that committee should look like as they are set with this task or otherwise.
Judge, I agree with you. I think, I would like to see us include investigators. I'd like to see us include both councils on, what this would look like. And let's get a big group. Well, we'll tell you that one of your main resources is out on maternity leave. And so I don't know how much we can engage her. But I mean, I'm willing, if this is the direction we go, let's commit the board resources to make it work in a timely fashion.
So who do we need a commitment from the executive secretary that those resources are gonna be made available?
The staff of the board is here for the service of the board members. So you let us know what you need and we're there for it.
So what is the mechanism to obtain that? Because emails obviously don't work asking. So what is the mechanism?
What did you ask for, Jeb, that you didn't get?
So I have 16 pages of email correspondence over the last 3 weeks. And asking for how .50 was created and who created it. And for examples on the technician section, if we intentionally put in those violations, or if it was just an oversight, was the staff member who created .50 specifically tasked with adding all these citations as many places as possible? I even bolded my questions to help them stand out from my lengthy emails, but I, as a board member, am not getting the responses that I feel like. No. I never got an answer to a question. And so my concern as a committee member, my concern as a board member, is A, how I get answers to questions, and then B, again, if 3 more of us plus me are gonna participate on this, how I get a response from the board, who's directly responsible for that.
And the reality too, that appears to be, and I didn't know that, I'm just learning about that now, a very toxic culture issue. For me, if a board member is messaging staff members and not getting a response, 20 plus emails, that is extremely inappropriate and problematic. And I would hope, John, that you are having some conversations with staff members to that regard. That's a problem.
Well, Judge, I'm also going to tell you, you probably need to read the emails in total because the tone and tenor of those emails was not collegial.
You'll respond with that. Respond with, I'm not going to respond because the tone and tenor of these
And
emails are
there are
inappropriate.
responses, there just aren't answers to questions.
Yes, that's creating a culture of defiance. That should be addressed.
I agree that the communication was not appropriate. I own that. I apologize for that. My interpretation at the time was that Dr. Cobb was engaged in those communications. That obviously was not a common understanding, so Dr. Mitchell, I apologize to you personally for my failure to respond to your communication.
Dr. House.
Speaking as a staff member, I think any staff member would be glad to pitch in and help in any way that John directs us. And says, you particularly at this time would be helpful. There's no one on the staff here that would say no or be difficult. I can promise you that. I have another question though. We've been holding some cases because they're going to require probably larger fines. They're much more serious or intense cases. So we haven't been able to go forward with some things because we don't have fines nailed down. And with full appreciation of everything you're talking about, I just wanted to mention the fact that it would be helpful to all of us to know we are eventually going to get to a point that we will have fines. Or maybe if there's a way to vote on half of them at one time and another half at another time. I just wanted you to know that.
So any more discussion
Yeah.
on
Yes.
the committee?
Believe it or not, I have a lot of comments on this. I know you all are very surprised, those of you who've been here before. Again, a lot. I'll start with, kind of going backwards order. I've never had an issue with staff response. It's been always prompt, precise, better than what I wanted in most cases. Susan's report today is something we've needed for a while, showing what we're doing and all, and that was an ask from somebody, I don't know, but a good response. I'm not sure, and I don't think it's productive to name names on who produced the original document of .50 or any of them, because it's our responsibility as a board to approve it or deny it. Our job is to charge the staff with coming up with an initial document, and then it's up to us to critique it. The document, when in final version, is our name, not their name. And when they do the work, and we ask them to do the work, and if we're gonna critique them in that way, I don't know if I were a staff member that I would wanna write another one again. So we have to own up to it. I don't know what in .50 is controversial when we didn't get any comments this last time. And that's why I made the motion to approve it, and I stand behind that, is because there were no comments. So I assumed that there were no problems, but we're moving on, Dr. Cobb, on from .50, as you said, and let's talk about the committee. I've done my homework. I was ready to discuss today. I went through the whole thing and put down the numbers that I thought should be right. Are they right? I don't know, and that's what I wanted to see us go through today. And if we can't come to a consensus today and we can't go through them all in a reasonable amount of time and you want to form a committee, I'm for that. I'm really tired of putting things off and trying to appease and change this word and that word and this bit. And the criticisms on the dollars, I agree with 100% from the public comments. But I'm not gonna shoot the messenger. We tasked the staff with coming up with a form to start with. They brought that to us and we got the comments, and now we're supposed to be today making those adjustments. But we don't need to criticize them. I know where the numbers came from. They came from Florida. Somebody go look up Florida's charts. See what they've got for theirs. Look at Tennessee, look at other states. That's what they looked at. And our numbers are right in there with the rest of them. So I'm ready to debate it today, and let's go through. I wanted to present, my opinions, and y'all shoot them down. I don't have a problem with anybody disagreeing with me at all. But if we can't do that today, then, and I don't mind being on the committee, I'd like to be on the committee. And I'm not sure how .50 limits us for doing anything. My understanding is, and correct me, Mr. Attorney, regardless of the ranges, we can still have other forms of penalties that are not financial.
Correct. This only affects monetary penalties.
So, if you want a motion, oh, the other part of that about the committee is this is what I would like if we're gonna do a committee. I'd like to do it as soon as possible, and I need some timelines because I don't know the laws on the rules. I should by this point, but I don't. To get this out, and let's make it public. The way we wanted to do it initially was, and what we had voted on was to make it public, and then we find out it's not legal. So we don't want to do anything illegal, and I'm not asking to do anything illegal. But that would have been the perfect way, is to put it out in a public document and let people comment between that board meeting and this board meeting and see and work through that so that we could come up with something final. Again, I'm not asking to necessarily do that, but if we as a committee, if I'm put on there and come up with something and can come up with something soon, that we publish that and start getting comments. We can't debate it. We know the law on that. We can't debate it as a board, but we can at least see that. And you can see it in advance. When we come in here and get this agenda, okay, every, a couple of days before our meetings, we've got all this stuff. And it's hard to digest it all, at least it is for me. And you got something like that that's so controversial, you're trying to digest it. It would be so nice to see that put out 2 weeks in advance, have comments, and let everybody be able to see what the committee did without breaking the law. Is that possible and feasible and can be done before our next board meeting?
We're clear. I'm gonna ask that
And I think
whatever
we've had
we,
more people come in the room. Need to add to the list, please.
And I would like to,
I was just gonna say, I would want the committee's work to be presented in a public meeting. What we present in a public meeting can be put on the website and we can have public comments before there's even anything published formally.
Wait.
Yep.
I'm not understanding. So if the committee meets, they can't publish that until after it's come to a public meeting.
I'm gonna say, let's just have it in a public meeting. So there's no chance of deliberation occurring outside of a public meeting.
We could call a meeting
Minutes.
to get it out there sooner. Like if we could call a meeting sooner.
Could call a meeting soon.
Yeah, and we can schedule a meeting if that's what we need to do. I think if we have a work group that gets together and let's say we charged a deadline of by our June meeting.
Sure.
And sometime toward the end of May, we find out, hey, we're ready to start working on this as a whole group because we've got a working document. We would have to have 7 days notice, correct?
Yes.
So we could have 7 days notice. We could have something prior to our June meeting, let's say at the first week of June. I mean, it just all depends on if the committee can, if we do the committee, which, I think is gonna be the most workable way to solve this. To get a working document. If we form said committee and they are done with that document expeditiously, then there's no reason why with 7 days notice, we couldn't. I mean, I wouldn't, if we have a meeting, if you'd have wanted a meeting Friday of last week when we're meeting on Wednesday, there's probably not a lot of purpose in that.
No, I understand. I was just saying, it sounds like there are people who are ready to work, and why not, in Dr. Alperson's comment, why not be ambitious? And if
Agreed.
there's folks ready to hammer this out, I don't know that we need to wait till June. If they can get something together in 14 days, we call a meeting and, I'm throwing things out there. If that's something that can happen, let's not wait.
I wouldn't want to put us on too tight a timeline.
I wouldn't suggest publishing, but if that committee gets together, they say, we've got something ironed out and it's all before.
There's no reason why we couldn't call a meeting and get it in public early. I don't think, is there?
I didn't hear the question.
So the question, or I guess the thing is, if we said we would like it due by June, in 14 days, the committee's gotten together and worked it out, right? Then would be okay to go ahead and call a 7-day meeting to come in and have a full group in public to go through said document so that it's.
Sure.
I just want to make sure that if we say June, we don't have to wait until June. But if we just said no later than June,
June, or it could be sooner.
June or no later than.
It will be published on the Secretary of State's website. Everyone can sign up to get those notices automatically by email. And so if we're done sooner, we can present it in a public meeting.
Right,
Yes.
so I'm gonna ask the question again. I'm looking around at head nods before we start moving forward. Any other comments first with regards to forming a committee?
Just the authority of that committee, and I don't want what my initial comments were to get lost in the sauce, so to say. I certainly understand Mr. Brooklier's comments regarding perhaps the legitimacy of the request or whether or not those requests were legitimate or substantive or not. Like, that's not my concern. Personally, I would never ask a staff member to do anything as a board member. I'll always channel that through John. However, it is a significant issue as we form this committee. If board members are reaching out for information and getting nothing, that's the core of my issue, not the substance of those requests. And I just wanted to make that clear because I think that got lost a little bit. And I think the only path forward, honestly, Mr. President, is forming a committee with full power, authority, and resources of the organization to come back with those recommendations.
All right, is that a motion that
For
you
sure.
just articulated right there?
Absolutely.
Okay, so I have a motion to form a committee of 4 with the full power and authority to task the board staff. Did I get that correct?
Yes, sir.
All right, I have a motion and a second. How do we vote? All right, and I'll vote yes. The next item would be who is going to be on that committee. I've got 2 volunteers I've heard so far, Dr. Mitchell and Mr. Brooklier.
I volunteer.
Who? You volunteer? Darrell, Dr. Dodd will volunteer?
I nominate Alicia Booker
Okay,
so that we'll have tech representation on the 4-person committee.
we good with that? All right, well, I'm gonna ask
Let's see.
Mr. Brooklier to chair that.
I love you too.
I do have a question as far as the platform of the meeting.
Yes.
Does it have to be in person? Could it be a virtual?
However y'all need to be. It's not a quorum.
I think it may be appropriate just so that we have the flexibility in case there needs to be meetings moving forward to perhaps add an additional the authority to call an additional meeting or workday per month until this is resolved.
We can go ahead and look at the schedule. I was gonna take a 10-minute recess. We're about an hour and a half. If y'all wanna look at the schedule and see if there's some additional days, we can put them on the book and always cancel them if needed.
Alicia, I want to make sure that you're okay with that. I didn't know if that was putting you on the spot.
I'm sorry for putting you on the spot. I was
No.
just, if you said no, I was moving to Stacy next.
Oh, no. Alicia, you're good with that, right? Okay, just making sure.
And we can work out a remote something, so you don't have to drive here, I promise you.
Yeah, the only days that I can't are first and second business day because I have to close financials, but
We'll work
past
on
that.
We'll make it work for you.
Think about possible alternate work days for the entire board to meet, or are we just talking
Well,
about committee days?
So,
Yes, the entire board.
what if we wait until we get let's see how far the committee is before we schedule something? We just have to have 7 days notice.
And I think to a point that Dr. Mitchell made to me, it would be very helpful from the staff level to know what is the mechanism for determining when a meeting is needed? Because historically, it's been the president makes the determination of the board, but then there might be opportunities where other board members need to meet, and it's not clear how those meetings are called, and I would appreciate some clarity on how that happens.
So that was one of my emails from Thursday. Please add to the agenda for next week an initial discussion of 34.23.91C. So the board members can understand that the president apparently is the only person who has, control over when board meetings happen.
But if we're governed by Robert's Rules of Order, which we are, Robert's Rules of Order tell us when and how.
That's only if we're
Meetings
in a
can be
meeting.
called.
That's only if we're in a meeting.
Okay.
But outside of a meeting, there apparently, according to council, is no structure for the board meetings for the board to ask for a special meeting.
I think it would be good if, that chapter 1 of the administrative code, that we're gonna be building that out. But a part of that can be building out our board governance in a more formal way. And
Voted on that before. We had extra meetings before and the whole board, the way our schedule is now is, the third week, but we changed a lot of that. It's all voted on by the board. It's not just done by the president.
Well, if we're in a meeting, then yes, we set the schedule and extra work days that way, but in between meetings, in between this meeting and next meeting, something comes up and we need to do that. And I'm remembering from several months ago that, there was an emergency meeting that we called that we had to do something and it was, it maybe even Gary at the time, we said, hey, Gary, we need to meet about this. Like, okay, let's call that, notify everybody, that sort of thing. But
It typically, in my experiences, had been at the request of the executive secretary to let the president know we need to have a meeting. And here's the rationale for why, and then with attorney to make sure that it meets the requirements of the APA. Because we have to be very careful about why we call emergency meetings without proper notice. Because, it can be construed as that we're trying to meet in secret. And so I want to be very careful about not calling impromptu emergency meetings that would give the appearance that we're trying to do something non-transparent. And so that's the concern. So it typically flows from the secretary to the president that there is a legitimate and legal request for a meeting.
I totally agree with that. We're a little gun shy. We've been accused of trying to subvert things by having an emergency meeting before. So we're just extra cautious. So I agree with Tommy in that we need to make sure that everything's on the up and up and that it's legal and we're following all the statutes. Even though we did that previously, we still got raked over the coals for it. So we just want to make sure, we're doing that. So.
Yeah, I think there's a difference in we need to have a 7-day notice for an emergency meeting or a 1-hour notice, whatever it is. And I think there's a lot of standards and a lot of tests that need to be met on those emergency meetings. All right, before we continue on to organization .10.20.23 in our agenda, I'm gonna take a 10-minute recess. So we're gonna go into recess now and we'll come back.
well, did you actually vote on the committee?
Oh, we need to vote on the committee.
Why don't y'all do that real
All right, so can I get a motion to accept the committee members as Dr. Brooklier, or Mr. Brooklier as chair, Ms. Booker, Dr. Mitchell, and Dr. Knight as committee members? Can you get a motion?
So moved.
All right, I got a motion. I can take that as a second. How do we vote?
Aye.
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 And I vote yes. All right, we'll take a 10-minute recess. We'll come back at 10:50. The next item on our agenda is the public hearing for 680-X-1.01. The amendment is being proposed to amend the composition of the Board of Pharmacy as mandated by Act 2025-372. We have received one comment on this rule. I looked for that comment. I couldn't find it.
The second one.
There's a PDF of an email in there that has comments on multiple different rules. 0.01 is first.
That's it.
So what's it listed under?
At the very top,
Public hearing comments?
underneath the
The
vote.
one right below that.
Right below that.
Okay,
Right below, sorry.
It's Krebs comments for all rules.
okay. Council, you want to comment on the?
I believe the gist of the comment has to do with who signs the APA forms when they are submitted to LSA. That is something that lawyers have different views on. I do not agree with the comment.
Okay, could you explain that a little further
Sure.
for those that don't know?
Sure. The Administrative Procedure Act says that notice of proposed rulemaking or certifications are to be submitted by an agency secretary. And so agencies across the state uniformly, they may use the chief executive or they may use a delegate to do it. Here, we've done it both ways. Most commonly recently, Dr. Nolan has signed those certifications. It is simply a ministerial act to certify that the board took a certain action. And my opinion is it's fine for a delegate to do that.
Is the person that's signing that statement ensuring its accuracy, completeness, meeting the requirements of the law? Or is that just a signature that means nothing?
You have to be up to accuracy and completeness.
Okay.
Certainly.
So accurate, so it's certifying that's accurate and complete.
It represents the board's action. Yes.
So who is the executive secretary of the board?
That's Dr. Lena, Mr. Lena.
So
Yeah.
presumably, would we as the board not want the person who's tasked as the executive secretary of the board to be the final signature to ensure that it's accurate and complete? I'm asking the board members that.
I think as long as it's legal and Dr. Nolan writes it, I trust everything Dr. Nolan tells me. She's very accurate with her information.
So
She's a
no offense to Dr. Nolan, but the .50 appendix that was put together that had technicians potentially able to be fined for the hours of the pharmacy not being posted on the door, that we decided we needed to remove. If the executive secretary of the board is charged with overseeing the operations of the Board of Pharmacy, I feel like as a board member that, to me, I don't know that he's even seen it if his signature is not on it, especially as the person hired by the board and paid by the board to be overseeing the agency. I think there's something to be said that the quality of the work that has been performed by the staff, he's willing to put his signature behind, that it's accurate and complete.
Is this stuff that the board has approved?
Yes,
Board's approved it?
yes.
We've approved it and I don't,
If we were,
if it's our document, I don't understand what matters who puts their signature on it. I mean, they're not, they haven't, forged it or obliterated it in some way, have they? Or something I don't know?
Are you saying that Dr. Nolan changes our orders
No,
when she
I'm not
sends them
saying-
out?
what it sounds like.
No, I'm saying that, as a business owner, as a pharmacist in charge, as a supervising pharmacist, responsible for my organization, something that's critically important, that I've got to stand behind in front of the practice of pharmacy, or in my case, my business, and that, that I think the leadership of the board or the leadership of the organization should be willing to put their name on the document that, that, that they're certifying to the board that for it to come to the board or for this to leave the board to go to the government, by me putting my name on it, I stand behind what that says. And I guess, is there a reason that you choose not to sign it? Maybe is a good question.
Well, as Aaron said, it's a ministerial task that Anne Marie Nolan was tasked by prior boards to complete. If it's the will of the board that the executive secretary sign those, certainly happy to do that.
So if there was an error in one of them, then we as a board have to take responsibility for it, not John or Anne Marie. So that the error you're talking about, or, that's our fault, for not catching it, not theirs.
For sure. But I think I would like, for me personally.
But he can't change it.
No, you can't change it, but I think there's a quality factor to the executive secretary's name being on the document if that's what this organization is pushing forward to the state.
I don't have a problem with that at all, if that's what the board says, that's fine. But you equated it to checking and verifying a prescription, and the law says we have to verify the prescription, and we can change it, and we can edit it, and we can send it back to be recounted and so forth and so on. They can't do that. When we send it to them, they're sending it to LSA or wherever. They can't change anything.
Their signature is simply saying that
The board
this document is what we passed, correct? So for the purposes of going forward, if Mr. Lena, if you'll sign this to satisfy the board members, if you'll sign this going forward. On the matter of .01, is there a legal issue that prevents us from voting to move forward with this today?
No, sir.
Okay. So I'll entertain a motion to adopt 680X-1.01 as written.
So moved.
I have a motion.
Second.
I have a motion and a second. How do we vote?
Johnny.
Aye, sorry.
Aye.
Aye.
And I vote yes. The public hearing for 680-X-1.02, Office of General Counsel. This rule is a new rule being proposed to clarify the two divisions of Office of General Counsel as mandated by Act 2025-372. We have received one comment on this rule. And I'm looking for that comment. Is that in the same document?
Same document.
Go to on it. Oh, there it is.
Down,
There it
further
is.
Order.
Because the office has not been divided,
That's what we're trying to
I
do.
thought that's what we did. Is that not what we did?
So this structure is mandated by our 25 Sunset Bill to separate the Office of General Counsel into two offices. I'm the disciplinary and Scott is the administrative. The gist of it in the statute, I have the statute pulled up, is that the legislature wanted there to be a way for license holders to call an attorney inside the board, that would be Scott Daniel, to answer questions, ask questions, receive guidance on things, without that becoming an issue where you call and ask a question, then you get a statement of charges, right? And so that is the way it is functioning, and this rule is designed to instantiate that in our administrative rules.
This says, and I quote, because the rule is untimely and the office has not been divided.
I recall that we divided it.
Over a year ago.
Yeah. So I think that's a false statement. Or an opinion. An erroneous opinion.
Council, do you see any issue with the current .02?
I believe it should be certified.
What?
I believe it should be certified.
Okay. Any other discussion? All right, so I'll entertain a motion to certify 680-X-1.02, Office of General Counsel.
So moved.
I got a motion and a second. How do we vote?
Aye.
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 And I vote yes. The next item is item number 5, old business, the public hearing for 680-X-2.23, drug manufacturers, wholesale distributors, private label distributors, repackagers, third-party logistic providers, outsourcing facilities, reverse distributors, and retail medical oxygen suppliers. The amendment is proposed to remove the civil penalty provision as they will be relocated to another section of the rules. We've received one comment.
So just as I'm reading these, Aaron, when it refers to violating code 41-22-6, that is the signature of
Same,
Anne Marie Nolan. That's the same for all of these.
same
comments.
issue that we just discussed. And I think the board said you want.
Okay, I just wanted to make sure that was the same as I'm reading through these,
Yes.
not to get bogged down in the same complaint.
All right, council, any comments on the comment?
I think the change is very appropriate to take that out of this rule and understand that it'll be addressed in other.
So we're just basically taking that, the penalty statement out of that and directing it to
5-0.
50.
Yes.
Okay, so it's just cleaning up that language so it's not listed twice.
All right, so any discussion on .23?
So we're going to address that when we have the committee.
Yes, sir.
Well, we can't do anything with this.
Right, I'm
now.
just saying that will take care of that.
That will.
Okay, all right. So moved.
Second.
All right, got a motion and a second. How do we vote?
Aye.
Aye.
And I vote yes. All right, the next item is old business number 6, public hearing on 680-X-2.36, continuing education for pharmacists. This amendment is proposed to remove the penalty provision for continuing education violations, as those provisions will be located in another section. We've received one comment. And I think the comment is still the same.
Right.
So is there any discussion? Not hearing any, can I get a motion to certify 680-X-2.36?
So moved.
Second.
Got a motion and a second. How do we vote?
Aye.
Aye.
And I vote yes. Public hearing for 680-X-2.37, continuing education for pharmacy technicians. The amendment is proposed to remove the penalty provision for continuing education violations, as those provisions will be relocated into another section. We received one comment. And I believe the same comment is applied to all. Anything from council?
Yes, sir.
Any comments? Discussion by the board? Not hearing any, can I get a motion to certify 680-X-2.37?
So moved.
Second. A motion and a second. How do we vote?
Aye.
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 And I vote yes. All right, we're on to old business number 8, update on other rules and current rulemaking. The following 2 rules have their public hearing on May 20th. Comments are due to Wendy Passmore, wpassmore@albop.com by end of business May 15th. 680-X-2.05 is community pharmacies, and 680-X-3-03, time and method of payment, renewal and non-disciplinary penalties for late renewal of controlled substance permits. Is there any discussion on board travel? Do we have any update on anything we need to discuss there?
We have,
Need to approve APA and LSHP. Yeah, do we need to approve APA and LSHP for the summer?
yes, Mr. President.
Okay. So let's take APA first.
I'm going to APA, but the board will not pay mine.
Do we have a presentation?
We do on the 7th, Sunday the 7th.
Okay, so who is presenting and who plans to
I'll present, and then whoever's there will do a listening session concurrently from 4 to 5:30 PM.
What date?
Sunday, the 7th.
Is anyone else going?
APA.
I'll plan to be there.
All right. We need to approve travel.
So moved.
Judge, would you be able or want to go since it's down in your area and come?
Dates?
June 7th through the 10th in Gulf Shores.
Yeah.
Sorry to even put you on the spot.
Iceland or Argentina.
Oh,
You get it?
There you go. All right, so we need approval for board travel for 2 members to APA.
So moved.
Okay,
Second.
got a motion and a second. How do we vote?
We clarified that's for Brandon's.
Okay,
Okay.
That's Brandon and who?
just Brandon.
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 Yeah.
So just be for one.
Right, just aye.
Aye.
And I vote yes.
Approving travel, I got a cruise I'm going on this summer. I'd like to
Stop.
So moved.
Oh, yeah, you're funny.
All right, then ALSHP, I know I am
I am.
presenting for leadership and then presenting the law update. Are you presenting as well, or do you want to present with me?
Yeah.
Okay. So that would be board travel for 2.
Oh, no, I don't travel.
You're not presenting?
No, I'm not presenting.
Okay, so it'd be board travel for 1. Gonna get a motion for that board travel.
So moved.
Second.
All right, how do we vote?
Aye.
Aye.
And I'll abstain.
And Tommy, I am gonna try to go, but I don't want more.
Okay.
I think it's just step on.
All right. Or item number 10 under old business, review the number of outstanding cases. Last month, we asked the staff to compile a list of outstanding cases so we can try to get those closed, and we'll defer that to Aaron. I think there's a list in our Dropbox.
There is a list in your Dropbox, and I'm gonna need to call on staff to help me with the exact numbers, but we did go through a large number of cases that we thought could be resolved and closed with what we're calling a advisory, compliance advisory with a administrative fine of 0, because .40 is in effect today. And we're using it to impose a fine of 0, which I think is the right resolution for these. And we have about 100 cases that we would like to suggest, give or take a handful. And so that is, I think, a good start. We're not finished with that review. There's probably a good handful more that will come in that we can recommend to you be closed with 0 or very little by the way of administrative fine.
Right, so there were no egregious.
These fall into 3 main categories. They would be failure to notify supervising pharmacist, failure to notify of a change in ownership, which is required in our statutes, and what will be the third one?
Ownership and AR.
And designated representative for manufacturers, right? So these are what, we look at as paperwork violations. They are important. They're in our statutes, they're in our rules, and it's important that people comply with them. But it's, like we've been saying in this room, it's not a way for us to raise revenue. These are compliance advisories to go out to these license holders and just close the cases with 0 fine.
Okay. Any discussion on that?
We'll need to read in the case numbers.
Okay, somebody gonna read those in for it?
Quick question.
Go ahead.
So in the body of the lawsuit, are these letters, are these being closed in a way that if the lawsuit prevailed and an injunction were held to stop us from enforcing .40, would that undo the work we've done on these 100 cases, or are these resolved outside of .40 in a manner that it doesn't?
That's a very good question. I think the legal answer to the question is the lawsuit would have no effect on it because there is no fine actually being assessed. It does cite .40 because we're using it as a mechanism to close the case, but it's actually not being closed with an imposition of a fine, but simply a compliance advisory. So it really, in terms of what is actually happening, it doesn't even rise to the level of a letter of concern. It's not a board finding. It is strictly an advisory.
That's what I'm trying to make sure doesn't happen.
I anticipated the question.
Yay, I'm free. But then all of a sudden,
Right,
it overturns
Right.
and we have to revoke it.
right, right.
So you feel very good about that.
I do.
Any discussion? All right, so I'll entertain a motion to resolve the cases that staff proposes we resolve at zero penalty.
So moved.
How do we vote?
Aye.
Unreadness, would we have to read each of these
Well,
into the record?
It is in your Dropbox, I believe. Yeah. It may be,
Do that.
it may be best for the record to read them in, although we do have the document here. It's kind of a formality,
Case numbers, is that?
case numbers.
I was gonna get us an acceptance that we were gonna do it, and then if we needed to read them in. Is that okay with you guys?
Absolutely.
Continue it.
Aye.
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 And I vote yes. So how do we want to read these in?
I'll take it. I'll try to do it intelligibly and quickly.
Uh-oh.
Two questions.
She doesn't want me to do it, I can promise you.
Here we go. 23L0043, 23L0332, 23L0450, 24L0260, 23L0090, 23L0333, 23L0466, 25L0036, 23L0126, 23L0335, 23L0467, 25L0042, 23L0159, 23L0336, 23L0468, 25L0046, 23L0191, 23L0370, 23L0469, 25L0050, 23L0192, 23L0418, 24L0025, 25L0055, 23L0201, 23L0419, 24L0032, 23L0204, 23L0203, 23L0420, 24L0091, 23L0238, 23L0421, 24L0103, 23L0261, 23L0422, 24L0126, 23L0262, 23L0440, 24L0149, 23L0272, 23L0441, 24L0221, 23L0307, 23L0442, 24L0222, 23L0326, 23L0444, 24L0223, 23L0331, 23L0449, 24L0259, 23L0304, 24L 0026, 24L 0180, 23L 0310, 24L 0027, 24L 0191, 23L 0315, 24L 0029, 24L 0192, 23L 0321, 24L 0031, 24L 0213, 23L 0328, 24L 0035, 24L 0214, 23L 0329, 24L 0036, 24L 0258, 23L 0330, 24L 0037, 24L 0300, 23L 0411, 24L 0075, 25L 0037, 23L 0412, 24L 0076, 25L 0038, 23L 0443, 24L 0099, 25L 0040, 23L 0448, 24L 0100, 25L 0056, 23L 0473, 24L 0125, 23L 0474, 24L 0140, 24L 0023, 24L 0161, 24L 0024, and lastly, 24L 0162.
The recommended action on those would be letter of correction or letter of notice and zero fine.
Compliance advisory, zero administrative fine.
Right, so that would be the motion. Do I hear a motion for that?
So moved.
Second.
A motion and a second. How do we vote to clear?
Aye.
And I vote yes. Thank you. We appreciate the staff taking the time to get those cleared up. The next item on old business is review of potential rules to add to chapter 680. The first being 680-X-1.03 declaratory rulings of the board, And the next one would be 680-X-1.04 petition for adoption of amendment or appeal of a rule. Council, do you or Mr. Lena have some discussion on these?
I don't have a whole lot to say about it. We brought this to you last month. This is a rule that, per the APA, every agency should have a rule like this in place. This is a mechanism by which, a formal mechanism, I should say, by which license holders, people who are regulated, companies who are regulated by this board, if they have questions about how our rules or statute would apply to a specific situation, they can ask us for a formal declaratory ruling to that effect. And it's actually judicially reviewable. If they don't like the answer, they can actually go to circuit court and get it judicially reviewed. All agencies are supposed to have a rule like this. And so I'm proposing it to you that we initiate rulemaking today for this rule.
Or 680X-1.03 first, correct?
Correct.
So any discussion on rule 680-X-1.03 as presented and in your Dropbox?
Is this an Alabama rule or that it has to be, or is it federal,
State.
state?
It's in the Alabama Administrative Procedure Act.
Thank you.
Black and white, but I can always read black and white, right? But number 2, where it says any person who desires, that means any citizen. That does not mean they have to be a licensee. So a citizen of the public.
No, any person substantially affected And that's actually right out of the statute as well. So it's not, it doesn't allow academic questions. It allows for resolution of concrete, actual controversies.
So if I were, and where I'm going with this is the pharmacy services permit question. So if I'm not, say I'm a licensed pharmacist, but I'm unsure if I require a pharmacy services permit. But I want clarification from the rule that what I'm doing, with that pharmacist who is asking about a facility or a pharmacy services permit, would we be able to respond to that?
Yeah, I would, I'm sorry, yes, sir. I would jump down to 2C. The petition needs to state facts sufficient to show that you are substantially affected.
Okay.
And so if the petition says, I'm a licensed pharmacist and I intend to do X, Y, Z things, under no means am I required to get this permit? Absolutely, yes, that would qualify.
So we've got it closed down enough that we won't have to deal with a ton of garbage potentially, but open enough that the right people with the right thing still have that access.
I believe that's right. That's right. And typically, I mean, you don't want to be buried in frivolous requests, but I don't think that agencies have that. Right, right.
I can tell you even before this rule, particularly during COVID, I found myself in a situation more than once where, you know, we needed to reach out to the board and ask if something was okay and proper. And we asked, we had discussions, and we got legitimate response, you know, timely responses. So
Right.
I think we're already doing a lot of these things.
Well, this doesn't foreclose calling Mr. Daniel.
I think we're already doing this, and I know that all of us field questions from time to time from not only other pharmacists, but also from investigators, just to make sure everybody's on the same page.
This is a formal and public process, by the way. I mean, if you do issue a formal declaratory ruling, it's in writing and it's public and everything about it is public. So people do still have the opportunity to make that informal phone call.
It gives us a pathway, if we're not comfortable stepping out on a limb, that we can advise them of this to do it in a formal process.
Particularly if they want something in writing.
Exactly. Yeah,
Right,
yeah.
that is often the case. And there are some times, and there's allowance too, that you don't have to issue a declaratory ruling, but if you don't, it's treated as a negative response. And so if the requester isn't satisfied with that, there's a pathway to court.
Any other discussion? So do I hear a motion to begin the rulemaking process, on 680-X-1.03 declaratory rulings of the board?
So moved.
Second.
All right, have a motion in a second. How do we vote?
Aye.
Aye.
Chip?
I'm sorry.
And I vote yes. All right, the next item is 680-X-1.04.
See, we're building out this chapter 1 of our administrative code. This also is required to be in place per the Administrative Procedure Act. There is to be a formal process by which members of the public can formally propose that new rules be promulgated and written and published, or that existing rules be repealed or amended. And so it works similarly to the previous one that we just looked at. This just has to do with, it's not how does this rule apply to me, but hey, I really wish you would change or repeal this rule.
Okay.
Otherwise, it's quite similar.
Any discussion? Okay.
Say if this has to be verbal, or can it be in writing?
It needs to be in writing. It's a formal written petition.
And for the other one, can you have answers on your website? Is that efficient,
That's
allowable?
That is still permissible, but the formal declaratory ruling process it's a more formal process.
So do I hear a motion to begin the rulemaking process on 680-X-1.04 petitions for adoption and amendment or appeal of a rule?
So moved.
Second.
All right, got a motion and a second. How do we vote?
Aye.
Aye.
And I vote yes. All right, next I think we had one other thing in old business that we added.
Yeah.
We're clear.
If you don't mind, thank you. I'll be quick. I don't think any of these need motions, but, a couple of them are really together. We have been, it's been said that, we are way overpaid as board members, so I have started keeping a time chart on, hours and spent on board work outside of board meetings, well, including board meetings and so forth. So for example, the month of February, I had 97.3 hours outside. I'd like to see the other board members do this, not as a necessarily a thing that we have to formally do or sign off on or vote on, but just to show the public that there are a lot of hours spent on board of pharmacy stuff. I don't know about you, but I really don't have 97 hours a month to spend, but that's what I did in February. And so I'm just asking the board members to do that. I'd like to see what that is. The second thing is the comments that we make $250,000 a year. And I would like the board members that have been here for a couple of years to please bring your W-2s. I have mine. I made $28,033.25 last year. So just trying to, and from the communication standpoint that we talked a lot about in the months past, is getting the truth out there so the public knows what we really make, what we really do. So the rest of that was, that I had, the actual fines list. Tommy started a, report with help of staff on, they're saying we're having excessive fines. And he did a 3-year span of how much we actually charged. I think you saw the list of things that we did not fine on, that the cases that we had. And then, he's worked on a report, and I don't know that he's ready to give it out now, but, that they expand on that report and show what the truth is on what the fines are for the public. Not necessarily specific cases, but in a aggregate thing.
Yeah, and Mr. Brooklier, I mean, I'm not ready to share all of that. I think we'll provide that information to the work group so they have that for historical reference, because there are some misconceptions. We talked about technicians, and, we had a maximum fine, I think, of $1,000 on some of those items. In the past 4 years, just for example, on technicians, I think that, well, the average fine has been $181. So we certainly have not been over fining our technicians. We did have some excessive or some larger fines for 2 in the technicians. One on a failure to disclose a significant impairment issue, and another one who was basically in the pharmacy practicing with no supervision and was doing so quite regularly. And then with regards to pharmacists, our average fine was $1,900. We did have some high cases for individuals, around $16,000 to $12,000 for actually the top 2 were $16,000 and $12,000. Both of those were issues of practicing pharmacy without a license for 2.5 years, and one of them with 20 different counts, compounding without a license, improper compounding Louisiana improper compounding. Louisiana fined him $27,000 personally because they had repeated practice with neglect or incompetence and failed to conform to minimal standards of practice of pharmacy and evaded and assisted in evading law enforcement. Now that's from Louisiana. So there are situations where fines are higher. That typically falls under the facility permits and the pharmacy permits. But I will provide all that detail to the work group, and then we will provide that full report later.
Thank you for indulging me.
All right, on to new business. The first item we have on new business is review operational guidance for replacement of an executive secretary. Mr. Lenny, you gonna?
Yeah, I'll talk about that. Do we want to, right before we jump into that, talk about the dates for the alternate meeting before we went to recess? We talked about possibly looking at the calendar. Are we ready to do that, or?
Let's do that at the end.
At the end. So in Dropbox, you'll have two documents. That's item 1 and 2 under new business. The first one is operational guidance for replacement of the executive secretary. And this is not a policy, it's simply a restatement of concepts from the Open Meetings Act, the Administrative Procedures Act, that really outlines steps the board should consider in the case of resignation, temporary, permanent, incapacitation, termination of a executive secretary, the very, very limited circumstances under which virtual meetings can be used. It specifies that discipline and job performance for executive secretary has to be discussed in open meeting as a public employee, et cetera. So this is all related to some sunset findings that happened back in 2025 and some procedural things. And I understand that there were some other issues with litigation involved in that, but this is simply a document to guide the board and for staff to refer to in the event that we need to replace an executive secretary, whether planned or unplanned, because it will undoubtedly be well, hopefully an unusual, but certainly a stressful event for everybody. So that's just guideposts for that. Certainly welcome the board reviewing or editing that as they see fit. But again, it's not policy, it's just guidance. So that's there for reference. Item 2 is a revision of the hiring procedure that the board adopted when I came on board. And it, again, refers to the Open Meetings Act, the Pharmacy Practice Act, the Administrative Procedures Act, and revises a little bit of information in the search committee meeting, a little bit in the application scoring, just to make the language a little bit clearer, et cetera. So it's there for the board to review, and if you choose to adopt this one, this is adopted as procedure currently, not this document, but an earlier version of this is adopted as procedure by the board. So the board would need to review and make a motion and pass that if they choose to revise in that way.
But we don't need to on item number 1.
You don't on item number 1, just because it's just a restatement of information that's already in statute.
Well, I can tell you, having those documents last year would have been helpful.
Yeah.
So I'm glad that we're putting that in place. Hopefully not for any imminent use, but
This would be the forum to discuss it.
any discussion on item number 1 or 2?
No.
Okay. Do I hear a motion to adopt the changes for the executive secretary hiring procedures?
So moved.
Second. Already got a motion and a second. How do we vote?
Aye.
Aye.
And I vote yes. All right, the next item is 680-X-2.40, non-disciplinary penalties. We received a legislative council co-chair letter regarding .40. And I think council has some revisions based on that letter.
Yes, Mr. President, and happy to show that to you guys. I don't know about you, but I was actually really happy to receive the letter from the co-chairs. It provided us some good guidance and also acknowledged some of the good changes that we've been making. So I was very happy to get this. If we can bring it up, it's, where are we here? New business, NB3, the Word document. Well, there's the letter. I trust everyone has seen the letter by now. But the gist of it there is, the gist of the letter was this. And we didn't see this in the statute, but it's there and they pointed it out to us and I'm going to show you how to fix it. But the gist of the letter was, no, what we really meant for y'all to do was to classify certain violations as always or nearly always non-disciplinary administrative, and others as always disciplinary matters. And the way that we had .40, the way that we currently have it written, is the way that it's written in every other state agency I've ever seen, which is a non-disciplinary penalty is essentially a proposal from the agency to resolve a disciplinary violation that you can accept or not accept. And if you don't accept it, it goes to a disciplinary proceeding. Well, the concern is, I think, that if license holders reject the non-disciplinary proposal, then they're going to go to a hearing and get what we call in the legal world a trial tax. You know, we recommended a administrative fine of $100, go to a disciplinary hearing, and lo and behold, it's $500. And I don't think that was ever any of our intent to do it that way. But I'm glad that we have the letter from the co-chairs, and I've done some work on how we can work on .40 to bring this rule in line with their instructions. And so it's on the screen now. I'd like to start with a little bit of this markup that is in 3, where we really elaborate on the procedure for this before we even get to what the co-chairs talk about in the letter. And I think this was brought up here in this room before. We all understood, but it wasn't really made explicit, that the decision on whether and what amount an administrative fine would not be a staff level decision. That would be a board decision. So we've made that explicit in, it's going to be about right there, in 3A. The decision to initiate is a board decision that's made in a public meeting, okay? We then elaborated more on in my proposed markup, we elaborate more on the procedure. This goes on to the next page, which I really think is important. The procedure here, and I think this is pretty much what we were planning to do with or without this language in the rule. But the way I look at this language about the process is not so much for us, but it's for the people who get the notice, right? I represent clients all the time. You get an investigative demand from CMS or something like that. Well, it always says in there, the legal authority for this demand is right here, and the process for challenging it is right here. That's always like a real relief to me, because this is not just some arbitrary executive action. There's actual rules that govern what the government guy is going to do and what we can do. And so that's what I'm trying to spell out here. It's not really for us, it's for the pharmacist who's been practicing for 30 years and has never gotten a letter from us before. And what do I do with this? Well, this is going to spell it out in more detail with more transparency. I don't think it changes what we were going to do, but it just spells it out. So that's just the process part. And if we can scroll down a little bit, we'll talk about, there we go, let's stop there. On E, we're making explicit that if you want to contest the proposed administrative fine, then it's heard as a contested case before the board, but it doesn't change it into a disciplinary matter, and the fine won't go up. It's going to be the same fine, and if you're not exonerated, which is also possible. It could just be this is a factual misunderstanding. What we thought happened didn't actually happen. But if the violation is substantiated, the fine won't go up. We're just making that absolutely explicit. Let's scroll down here a little bit more. And then I revised the language about the National Practitioner Data Bank to make it, the NPDB is governed by federal law. We have to follow it. It's a little bit hard for me to imagine non-disciplinary violations that are going to fit in .40 that are reportable. These should, 999 out of 1,000 seems to me will be non-reportable. I just always plan for the unexpected. There could be one that ends up being reportable. So there's just information there that we don't plan to report these, but it could be. All right. And then 5, again, just reinforces that if you have a disciplinary and a non-disciplinary together, the disciplinary is going to stay disciplinary, and the disciplinary is going to stay non-disciplinary. And I think that pretty much covers the gist of the proposed markup. I believe that these revisions address the concerns that are raised by the co-chairs in their letter. I think it's important that we have it on the screen today. If I could snap my fingers, I would change the rule, I just snap my fingers and change it today. But there's a process for doing that. If you all would like to initiate this today, I think it's ready to initiate a rulemaking proceeding to make these changes. If you want to keep it for a month and look at it next month, I think that's fine. I think it's good that we've put this on the screen today and said, this is what we want to do to bring it in line with the co-chairs. We can do it today. We can start it today, or we can start it in May.
Any discussion on that?
I have a question on, on the very first page. If I'll scroll up to number 2A. So the first sentence, the board will impose an administrative fine for any violation listed. The next sentence says, if the board elects to issue an administrative fine. So our first statement says we will, but my understanding was the ranges were 0 to blank. So that
Change that to May.
that gave me the option to,
Yeah, that's a good catch. I mean, I don't recall exactly what I was thinking when I made that change. I think what I was probably thinking, Dr. Mitchell, was it's not discretion to call it administrative or disciplinary, right? But I think your point may be well taken that we could have possible administrative violations that we choose to just
settle it. 0.
close without.
Yeah.
Yeah. So that may be and I didn't mention here too, there has been some discussion about the 10-year repeat violations within a 10-year period. That does feel long to me. I didn't mention that at the outset of this. So my markup just changes the 10 to 5. I think that's probably more in line with what we would think is an appropriate window for, if you have a repeat violation within 5 years, well, you didn't hear us the first time, right? 10 years is a long time.
And this is something I did work on at home, and being a new board member, I don't know the mechanism to offer alternatives or suggestions to the group without violating the Open Meetings Act. So like if we prepare something on our own for other people to review, what is the proper mechanism for a board member to submit that to not violate any provisions?
We could submit it right now
Okay.
in the public meeting, and the board could look at it and consider it, and the board could keep it over. I don't know if the board's pleasure is today, but
You certainly could submit it to today, and we could not vote to start the rulemaking process till next month. And that gives the board opportunity to get it into Dropbox for the next meeting. Certainly couldn't be any debate over it, and then having not seen
Exactly.
what I'm not gonna expect the board members to vote on a replacement that they've not seen.
For sure.
The typical mechanism would be, if you have a rule that you want changed, typically what we've done is task staff to work on that rule to meet whatever end it is that we're trying to meet. And then they bring back proposed language. We work on that proposed language. I mean, you have it in your Dropbox, obviously, hopefully a week or so ahead of the meeting for you to review and be prepared to discuss. And then, if it's acceptable, then we would start the rulemaking process. So if you've got language that you would want to replace, Like it's essentially a repeal and replace, I would guess.
Or just amend, but.
Yeah, well, I mean,
Whatever it's called, yeah.
yeah, so I think probably getting that to board staff for them to incorporate your comments into a version. And then we can get both of those versions into Dropbox for next meeting. And then we can hold a vote then. Is that acceptable with everybody? 4-0?
Sounds good to me.
How are you gonna get comments on it if the?
You're not gonna
Okay.
get, you're not gonna get comments yet. It's not gonna be public comment. You'll,
Until next month.
we haven't had a chance to review it.
Okay, I got you.
So,
That time.
so it'll get into Dropbox and then next month,
I got you.
we would be able to take up whether or not we want to accept council's changes or Dr. Mitchell's changes and or both.
Some blend.
Yeah, right.
Why don't Dr. Mitchell get his to council unless,
And prepare those so that we can see them. But I don't want to take action on something we've not seen.
100%, and I wouldn't ask for that, so I would respect that. So, I would like, again, especially if we have even a minor concern with the first sentence, that we take it the month to fully look through the document and make sure there aren't any unintended consequences. But obviously, there could be more discussion.
All right, so if we can get that document to council and then we'll try to take that up next month. Okay. All right, the meeting date. So what dates were we looking at?
So
And then let me ask this, because I'm gonna direct this to Mr. Brooklier right up front. How long do you think you guys will need before we need to have a?
probably about 5 minutes.
How many days?
I would think, a day and a half, 2 days, to help, relatively long meetings. Just do it and then come back with, a wrap up and clean up if there's anything, but I would, and we can do some communicating by email and stuff ahead of time, so we're not just blindsided with what's out there.
I guess my question is, if we're gonna set a date to have an additional meeting, when do we need to set that? Do we want to try to look for the first week of June?
I pulled up my calendar. I was gonna get with them afterwards and see when they're available, but I was hoping that we could meet, next week, and no later than the week after that. Starting in the morning at some, 9 or 10 o'clock and go till whatever. But I
Yeah,
don't know.
I'm talking about for the full board for y'all to
I know,
report.
but we need to know when we're gonna meet to know when that can be, because you gotta notify
That's kind of
a
my,
week or two ahead.
so do we want to go ahead and put a date out there, or do we want to wait until they have something to present and then do a 7-day notice? I hate to put a date out there and then them not make it, and us have to cancel.
I mean, I'm picking on Alicia here, but if Alicia's going on a vacation for the next 2 weeks, then we're obviously not gonna meet the next 2 weeks. I don't know her calendar. I mean, I'm saying, so.
So I know it's hard on everybody's calendar, but can everybody work on a 7-day notice or a 14-day notice
To be here.
to be here, or at least be virtual? I know, Judge, you probably got the longest commute of all, and it's not an easy one, as we know.
We have provisions in place for virtual,
No, we couldn't do virtual for this, I'm afraid. I could stretch it, but I don't want to stretch anything.
I don't know that we would be doing the rulemaking, but we
Well-
can hammering out the details. We would have to start the rulemaking process.
That would be the argument.
But if we had a majority here, but had the others on, it would, virtual,
The,
That couldn't be.
would that not be?
well, the statute says you can't do rulemaking with a board member participating remotely.
How many days' notice do you need?
or do we just work to do this on the next board meeting? Like, the committee meet between now and the next board meeting, but they'll present it at the next board meeting.
Well, I'm fine with that. I think we are probably gonna need a working meeting. I want to set it, but
I
I
get your
don't
point.
want to set it to cancel it. I'd rather let them tell us, hey, we're 10 days out, and then let's put notice out.
Are we talking about the full board or just the committee?
I'm talking about the full board at that point, when the committee is ready.
So can the committee not just present to the full board at the next meeting?
You could. You could.
So, yeah, so I mean, and Johnny, you're the one with it. I mean, before y'all the ones back here with experience. I'm the new guy talking, so don't let me talk you into something that's not right.
Well, I think it's big enough, Jeb,
I was hoping to get comments before the May meeting. So if we get it out there before then, and you can't get it out there until the full board meets, if we can't do it, we can't do it, but that's,
I think that's gonna be pressed if.
I think that's aggressive.
Well, if Alicia's out 2 weeks and then I'm out. the
I'm
first week of
joking
May.
about Alicia's vacation. I just, that was
I'm
perfect.
sending you on vacation, sorry.
So our board meeting,
May 7th.
I'm out of town.
yeah, and then we're all, several of us are out the following week and then the board meeting's the next week.
I think we just have to get the committee work done as much as we can and present at the next meeting.
Okay. Is everybody okay with that? And then if we need to have if we get to the point where we need to have a separate meeting after May meeting,
Then we can.
between May and June, then we can schedule it then. But I think anything between now and the May meeting is probably a very aggressive timeline for that committee, because this is a very big task we've asked.
Sure.
So is that fair with everybody? I'm not gonna vote on it, but I'll look at nods of heads.
If I could see you three after
Yeah,
our meeting, and
absolutely.
let's look at our calendars and see when we can meet as a committee.
Okay. All right, I think we have one more item, council.
That is, case reviews, Mr. President. Yes, Mr. President. I have a few thoughts about how we're doing CRCs, our case reviews, and I'd love to propose something to you guys today to consider. If not today, then going forward. I want to start by saying I tend to respect custom and tradition in a lot of different circumstances. I'm also new here, and I don't know everything, and I don't pretend to know everything. However, as we're having these conversations about increasing transparency and increasing public awareness and insight into how we do things, how the sausage is made here, the thought has just occurred to me that CRCs, the way that we've been doing them in executive session, is not legally inappropriate. I think it's a legally justifiable use of executive session. However, the public meetings law says that executive sessions are never required. They're always just permissive. They're not mandatory. I have been wondering if there would be benefit to us doing the CRC process essentially same as we've been doing it, just in public. So that the public can see it. There will be better visibility into the number of cases that we just closed with no action. There will be more insight to our thinking about how we look at cases. And also possibly less opportunity for write-ups with examiners and sunset reviews, because they always look very carefully at executive sessions. So that's my thought. And I wonder too if CRC might fit better on Tuesdays while we're doing cases per se. Obviously Tuesday's behind us this month, but I throw that out for the board's consideration and wonder what your thoughts are.
Well, I certainly have no issue in doing it public as long as council's okay with it and that we're protecting.
They are anonymized,
Right, so the people in the cases.
right?
But, so if we do this in public, then would we be, I know we all read them individually, but, would that lead us that we need to read each one of these licensing cases, the
No.
whole thing? I
No.
mean, because I can just see the amount of time this is gonna take.
You don't need to do that. You can discuss them and deliberate them if you need to, but you don't need to read all the narratives out loud.
Okay, because that's gonna take, there's 26 cases
Sure.
and it's gonna take 2 days to read all those out, you know. the
I'm a
length.
fast reader, but
Yeah, that's true. We may have to get you to do that. Just, that's I don't mind debating it, here. It's just convenient when we've all read it and we just say, look at case number so-and-so. I think,
I think, does the public know what we're talking about when we say CRCs?
probably not.
No, okay. When a case comes to an investigator and it comes to the board, and y'all help me here, that comes to the staff, then they decide if it's a statement of charges. Somebody's selling Norco out of their trunk, it's obviously gonna be a statement of charges, and they're gonna come before the board. Some of these things are, they've got a complaint from a a person who said the pharmacist treated them rudely. And as a board, they have to investigate it, and then they can't make a decision on that. So it comes to CRC, and they'll not put the person's name who was quote rude or anything. They just tell us the situation, and then they have a recommendation, and then we decide. So everything, in spite of what's been said in the public, everything comes through the board. So those are CRCs. Now, some of them are more serious than they've got a customer or patient who complained about somebody being rude, a misfill on a prescription or something like that. And then we decide, is it gonna be a statement of charges? It was something serious that needed a statement of charges? Or is it, a letter of reprimand or, corrective action plan or nothing? So that's what CRC is, okay? And then we meet and pass an executive session and just go through those. And those were the numbers you saw on the board that Susan had done that showed that how many cases we deal with that never come to the board as a statement of charges. Okay?
So are we ready to do CRCs today?
I think we have them in the Dropbox.
All right, so if everybody will look in your Dropbox under April CRCs, make sure you're looking at April and tab, please. I'll just open the floor if there's any questions. See, Dr. Anderson's in the room very conveniently. To answer any questions that we may have. I had one in reviewing on the last case, 26-0056. Do we know if this person's working anywhere?
I didn't come prepared. I didn't know we're doing this, so.
Sorry, we're notified.
Just gotta get her information.
Yeah.
We're asking her questions.
Which case
The
was that?
last one.
Two,
The very last one.
238.
26-0056.
You'll, wait, you gotta click. Search.
Is that good?
Search.
Search the-
Very last one.
It was 26.
26-0056.
130.
Technician failed random drug screen.
Okay, that one, when I checked it last time, she did not show any current employment. But she was released from her other job, so we don't have any updated information since that.
There's no need for an emergency suspension.
Not at this point. One of the investigators can follow up. She wouldn't make a statement at the time of the investigation. But we could follow up with her if necessary to see if she has gained employment in a pharmacy since then.
Obviously, there's some concern about her working until we.
She has not changed employment on her profile.
Okay.
So, she can, of course, refuse to make a statement to the investigator, right? And that leaves us where?
So you're just reviewing the facts that were gathered by the investigators at that point.
If you felt it necessary, you could take it on to an SOC and have her here for a hearing and have a more clear and concise
Well,
idea.
that's what you've got as a recommended action. I just wanted to make sure there wasn't something more urgent we needed to do.
Not that we see.
Are there any other questions? Dr. Anderson or Investigator Shaw?
Can we read a couple examples? Just smaller ones, a couple examples, just let them know what they want.
I'm gonna defer to counsel on that.
Yeah. Can you abbreviate one or two, just so, because I feel like everybody's sitting back there like, what are they talking about there?
I don't know that I can pick one or two on the fly, Dr. Mitchell.
I could
I will say, it looks like that case is the only one that initiates an SOC of all that we have.
So if we're gonna,
They're like line 19.
you wanna describe that
Line
one?
19 of the sheet, case 0044.
Sure, that involves a case involving a pharmacy for not filling a patient's hydrocodone prescription They reached out, and the patient actually did receive the script the day prior, so that's being withdrawn. The case that was being discussed a moment ago that we will initiate an SOC on involves a technician who failed a random drug screen for THC. So we'll look at that, and that person has also been advised of the wellness program being available.
I would like to look at, case number 250119. We've noted that there's a letter of concern, but I believe I don't, I don't see that, we have any reason to send a letter of concern on that one.
The investigator could not prove or disprove the allegation. So we felt, in all fairness to the complainant, that we would tell the pharmacy that, hey, just be more careful moving forward, more careful with your inventory, just so we have a better black and white case moving forward.
Had recounted the capsules and reviewed the camera footage.
Patient was provided with a 10 that was short, so I agree with you, Stacy.
I don't know that, there's no proof that there's no proof that they were short 10.
Right.
I think they went above and beyond to provide the 10. But, I think if we do some type of letter, we need to suggest that they do, I guess, more documentation as to what they did. Not on, it doesn't tell that they recounted the stock inventory. That would be the only other step that I would see that would be proof.
So letter of education.
Letter of education, maybe, I think, just to say, hey, it looks like they did the right things and it was proof, but if they put that extra layer of proof that we counted inventory and it was correct, I would think, so I feel like they did their due diligence, but they could have put one more step in there to just seal a case.
All right, so we're gonna change that one to letter of education. All right, any other ones that need to be looked at?
Well, the one right after that, the 0031, well, technician taking a dose of Claritin D. I assume, is that over the counter Claritin D?
I'm assuming it was a Claritin D they pulled because it was getting ready to go out of date. So I was assuming it was behind the counter at the time that she took a dose out of it. And Claritin D is traditionally behind the counter now.
I guess that's Sudafed. I forgot the Sudafed part. I'm a infusion pharmacist here.
Don't deal with that, huh?
All right, do you have a recommended change to that?
No, I forgot about Sudafed having restrictions because I don't spend stuff.
All right, any other recommended changes or questions? If not, I'll ask Dr. Hicks to read into the record.
Read it, says it.
Bring him off this. On the fly.
We only changed the one thing to a letter of education.
Correct.
All right. In case number 260038, 260043, 260062, 260063, recommended action is no violation.
Second.
So got a motion and a second. How do we vote?
Aye.
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 And I vote yes.
In case 2501192600029, 2600031, 2600049, 2600052. Recommended action is letter of concern.
Second.
All right, got a motion and a second. How do we vote?
Aye.
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 And I vote yes. I do have a question. Did you say 250019? In that?
You said 0019?
Yes. Did he read that one in, Sherry?
Because that was the letter of
Yeah, we
education.
need to change that to letter of education.
It's frustrating her.
We normally do this. We didn't know we were doing it out here. We normally have,
You said 19,
Okay, so we need to change that one. You'll make that motion.
recommend action, a letter of.
Education.
We did the motion.
So for 250019, recommended action will be letter of education.
second.
How do we vote?
Aye.
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 And I vote yes.
Hang on just a second, please. Is it 19 or 119?
119.
Yes, 119.
119.
That's what I wrote was 119.
Okay, I thought you said 19, that's what I was just
I
making
think
sure.
he initially said.
Thank you.
All right.
Yeah. All right.
We done it.
Case 250120, 250197, 260002, 260018, 260044, 260050, 260055, 260060. Recommended action is no further action.
Second.
Have a motion and a second. How do we vote?
Aye.
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 And I vote yes.
All right, in case 260051, 260057, recommended action, letter of concern and corrective action.
Second.
Got a motion and a second. How do we vote?
Aye.
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 And I vote yes.
In case 260056, recommended action, initiate a statement of charges.
Second.
Got a motion and a second. How do we vote?
Aye.
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 And I vote yes.
This time I have no further cases, Mr. President.
Okay, do we have any more business to come before the board today?
Nope, nope.
Not hearing any, we are adjourned. Thank y'all for your work today.